I'm here today to get a liver checkup. And the fact of the matter is I feel well, but that doesn't tell me how my liver's going. And I do the things that I need to do to look after myself. I'm not drinking much, trying to eat properly and exercise and all that. But again, I feel okay. So the only way I can know how my liver's going is to come here and have regular checkups. Some of the people I've met over the years have not known they've had hepatitis and have kept up with their normal lifestyle, and the first symptom they've had has been severe liver disease, and they're in quite a bad way. So I want to keep track, I want to keep healthy, and I want to look after myself and know how things are going. And it is the only way that you're able to keep track of how you're going, because most of us with hepatitis don't have any symptoms. It doesn't hurt. I don't know if any of you heard about the old days, or if anyone's heard about the old days when you had liver biopsies. That did hurt. It wasn't a pleasant procedure. It's not like that anymore. It's vastly better than it used to be.
People always want to know whether a liver checkup hurts. Well, what a liver checkup is really just sitting down with your doctor and having a talk about your liver health. It's about what you've been doing in the last little while in terms of your alcohol consumption, in terms of your diet, in terms of your physical activity, all the things that might put extra stress on your liver. And it's about looking at the current status of your liver, looking at the blood tests, maybe getting an ultrasound, and maybe doing a FibroScan, which is a non-invasive way of looking at how stiff your liver is. So everybody who has a liver condition, whether that be hepatitis C or hepatitis B or fatty liver disease, needs to have a regular checkup to see how they're progressing and whether their liver disease is stable, perhaps even getting better if something's changed in their lifestyle to make it so, or perhaps getting worse, which would be a trigger for doing some extra investigations or some extra treatment. Granville, good to see you again.
Good to see you again too, Simone.
So you're here for your regular checkup?
Yep.
So you've had this hepatitis infection for many years now, and it's really important that we go through a process every so often, every year, to do a checkup of your liver health. And it's really important to keep doing that because that gives us an opportunity to see whether your liver disease is getting any worse over time. So what have you been up to in the last year? Are you drinking any alcohol at all?
Well, I'm still drinking alcohol, but yeah, not very often, and always in moderation when I do, because it affects the liver so badly.
And you're keeping your weight good?
I have always struggled with my weight, as you know, but yeah, it's gone down a little. Hopefully, go down more in the future.
Are you getting plenty of physical activity?
I've been getting regular exercise for the past few years. I've joined a gym, and yeah, trying to eat well and generally not get too stressed.
You stopped smoking a few years ago, I remember.
Yep. Yeah.
So you're doing all the right things to keep your liver as healthy as you can, but you've still got the hepatitis virus there, so it is really important that once a year, or even more frequently in some circumstances, that we do a checkup. And the reason for doing all these tests is to see whether there's a timing of when you want to have treatment for your hepatitis infection. Because if we show that there's really very little going on, very little scar tissue, then there's no urgency for treatment. But if the disease is progressing, then it becomes more urgent to treat and try and eradicate the infection. Well, let's get on and get some tests done. So when we do a physical examination as part of a liver check, what we do is we're really looking to see if there are any signs of liver disease occurring in that person. So we'll do a very full examination of the hands, of the chest, of the heart and the lungs, and of the abdomen. And what we want to do there is see whether the liver might be enlarged, whether the spleen might be enlarged, and whether there's any fluid that might have accumulated in the abdominal cavity or in the legs. When we do a FibroScan, it's a very straightforward procedure. It might be able to be done at the same time as the consultation if that's available, or you might have to come back on another day. What it involves is having a fasting period for a couple of hours before the procedure, then just lying down on the couch, exposing the upper side of the right side of the abdomen, and then there's an instrument that's just placed between the ribs, a button is pushed, and 10 readings are taken to see the average of those readings. Each of the readings is consistent with each other, then that will give us a stiffness score, which your doctor will then be able to interpret and tell you how much scar tissue might be present in the liver. The other beauty of it is it's a test that can be done on a regular basis. So we might choose an individual person to repeat the FibroScan every year to see whether there's any progression of scar tissue. Many liver clinics now have access to FibroScan technology to be able to assess the liver stiffness, but there are many clinics around the country and many places where patients are assessed for hepatitis where FibroScan is not available. So once we've got all the results of your tests, we'll sit down, we'll review your blood test, review the results of the ultrasound and the FibroScan. And that means for you, we can determine whether you've got significant problems going on in the liver, there's significant scar tissue build-up, whether it's progressed from the last time you had your checkup, or whether it's really very, very stable and pretty mild. And that can be incredibly reassuring if we find that you've really got very little liver disease.
Go ahead and do it. It's useful information. You don't know how your liver function's going unless you do check, because you can feel okay and still have quite bad liver function.